Thank you for meeting during this busy time and being so attentive. We have 3 bills, or 1 bill and 2 resolutions to consider during this meeting. So I would like to go ahead and call this meeting to order and have the secretary please take the roll.
Representative Bentley.
In the room here.
Representative Bowling.
I'm here.
Representative Bray.
Here in the room.
Representative Birch. Representative Dotson. Representative Elliott. Representative Fleming. Representative Frazier. Representative Marzian.
Here in my annex office.
Thank you. Representative Prunty.
Here in the room.
Representative Rayburn.
Here in the room.
Representative Raymond.
I'm here in my office.
Thank you. Representative Riley. Representative Sharp. Representative Sheldon.
Here in the room.
Representative Tate.
Here in the room.
Representative Weber. Representative Westrom. Representative Wilner.
In my annex office.
Thank you. Chairwoman Mosier.
I'm here in the room.
We've got a quorum.
Okay, we have a quorum. We have an established quorum to do business, and I'd like to go ahead and get started. First, we would like to welcome Chair Alvarado to the table to discuss Senate Joint Resolution 59. We do have a committee sub. We have a motion on the sub and a second. All in favor?
Aye.
Any opposed? Okay, thank you. And this is a resolution that I helped a little bit with, but Senator Alvarado, if you'd like to go ahead and introduce yourself for the record. Sure. And present, I'll help as needed.
Sure. Ralph Alvarado, State Senate 28th District. I know the original joint resolution was a product of the Substance Use Recovery Task Force. I know some members of this committee served on that task force. I know Representative Weber also co-chaired that with me. Did a lot of good work. We heard from dozens of individuals, people involved in substance use recovery, both from a treatment aspect, from the judiciary system, some of our jailers, talking about some of the programs that are out there, trying to find ways to reduce barriers. This resolution in its original form was basically directed, and again, it's pretty self-explanatory, but directed the Cabinet to establish a work group to create written recommendations for distribution throughout Kentucky for individuals who suffer from substance use disorder in order to reduce the barriers the individuals experienced when attempting to access opioid disorder treatment programs. There were several resolutions that were filed. This was one of them. We also had one, 68, that was an opportunity to set up a pilot program to be able to take a look at people for transitional housing. And I think the sub, Madam Chair, if you'd like to explain some of that. I know you've worked really closely with some individuals trying to get a pilot program set up, and that's part of this resolution as well.
Thank you. You're right. I have had the honor of working with Governor Ernie Fletcher, who is very keenly involved in addiction treatment and creating resources and lifting barriers for individuals. That's really what this does. This looks at creating a work group, as you said, within the cabinet to take a look at setting up a pilot to do coordinated care, building a continuum of care, and just taking a look at funding mechanisms. So this is a very difficult issue. We know that individuals with a substance use disorder need comprehensive, coordinated care, and this is just an opportunity to really dive into that issue. So I appreciate your work.
Thank you. And again, for those of you who don't know kind of transitional housing, there's different terms for it, but effectively people go into inpatient treatment. Once they come out, if they go back to the same environment, sometimes it's difficult to break those cycles, and it helps them transition back into workforce, getting back in, getting control of their lives again, and helping them in the recovery. So we're trying to find funding for that, ways of getting that done, and this is going to hopefully do that. I have hopes that perhaps not in this budget, but the next budget, being able to put something in to help us fund some of those programs.
Absolutely. Thank you. And also looking at federal dollars, Medicaid, and ways to assist the state in some of that funding. So are there any questions from the committee? Oh. Representative Sheldon.
Just quickly, and thanks a lot. This is a fantastic resolution, but I think there would be a great opportunity here, just looking and understanding how this works, as putting together some private state type partnerships to, that would that would come together and provide some of the funding that we need. I can think of just several private entities that would love to be in partnership with, I think, our cabinet. So I hope that's something that this particular task force is looking at.
Okay, thank you. Representative Westrom.
Gosh, 10 years ago, this was a topic that people didn't talk about. If someone in their family had a substance abuse disorder, they didn't talk about that either. And now we see such a vast population that has been affected by this, and there has not been any continuity across the entire state. This is a great idea. I look forward to the outcomes.
Thank you. And again, I think it's because no one talked about it, but I think everybody has to talk about it because I think it's hit almost everybody's homes just about, or at least someone in your immediate circle of friends. We're trying to find ways of destigmatizing it and recognizing that it is a disorder, and that we have to get people some help and get them back into mainstream.
Thank you. Representative Rayborn.
I just want to commend the work that you've done on this. Anytime that we can break down barriers for people suffering from substance abuse, that's a good thing. I represent Carroll County. They've been hit really hard, just like a lot of other counties in Kentucky. And a lot of the time, the issue is, like you had noted, people go into those facilities hoping to come off that substance, and then they get put right back in the same situation. It's just a revolving door. So thank you for this work.
Okay. See no further questions. I will entertain a motion on the resolution. We have a motion. A second. Okay. Secretary, please take the roll.
Representative Bentley?
Yes, ma'am.
Representative Bowling?
Yes.
Representative Bray?
Yes.
Representative Birch? Representative Dotson? Representative Elliott? Representative Fleming? Representative Frazier? Representative Marzian?
Yes.
Representative Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond? Representative Riley? Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber? Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes.
Yes.
Senate Joint Resolution 59 passes as amended by the committee sub with favorable expression. Thanks very much for your work on this. We do have a title amendment. We have a motion on the title and a second. All in favor?
Aye.
Any opposed? Okay, thank you.
Thank you, Madam Chair, members of the committee. Appreciate it.
Thank you. Okay, next we will go to Senate Bill 163. Do we have our presenter here? Is Senator Kerr with us? Okay, we will shift then and go to House Resolution 78. Representative Wesley is here with us. Please introduce yourself for the record, and the floor is yours.
Thank you, Madam Chair and committee. Appreciate being here with you. My name is Bill Wesley, State Representative over District 91. I'll be presenting House Resolution 78. This would consist of the House of Representatives requesting that the Cabinet for Health and Family Services to do not establish any new requirements related to out-of-state travel for children in out-of-home care during any state of emergency declared by the governor in response to the COVID-19 virus or any mutated strain of the COVID-19 virus that is any more restrictive than requirements that were in place on February 1st, 2020. As of December 2020, there were 9,278 children in the state of Kentucky in foster care. The number is increasing and the need of loving foster parents is greater than ever. It doesn't benefit anyone to make it harder to become a foster parent. Foster care is supposed to be a safe place that gives a child and their birth family an opportunity to resolve conflicts or disruptions and learn healthy skills so that the child will safely return home. By restricting travel, it would and makes it unnecessarily difficult for children to have visitation with their birth parents.
Okay, we have a motion and a second. Thank you for your presentation. Very succinct
Yes,
and
ma'am.
clear. I appreciate that. Are there any questions from the committee? Okay, seeing none, Secretary, please take the roll.
Representative Bentley?
Yes, ma'am.
Representative Bowling?
Yes.
Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Yes.
Representative Frazier? Representative Marzian?
I'm going to pass. I haven't had a chance to really look at this one, so pass.
Thank you. Representative Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond?
Yes.
Representative Riley?
Yes.
Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Representative Weber? Representative Westrom? Representative Wilner?
I'm a no on this for today.
Chairwoman Mosier?
Yes, ma'am. House Resolution 78 passes with favorable expression. The same should pass on the House. Thank you.
Thank you, Madam Chair. Thank you, committee.
Okay, I think we are awaiting the arrival of our presenter, so we will stand at ease for a few moments.
Madam Chairwoman, down here behind the pole, would you have the clerk record a yes vote for Senate Joint Resolution 59 as a yes? Thank you.
Yes, sir. Thank you. Are there
Can we
any
do
other
the same,
members
please?
who need to record a vote?
Yes, please. Representative Raymond, yes, on Senate Joint Resolution 59.
Thank you very much. Okay, I see that Representative Timoney has joined us, and so we will allow you to introduce yourself for the record. Thank you so much for coming over to discuss Senate Bill 163, and if you have any guests, introduce them. Otherwise, please proceed.
Thank you, Madam Chair. I apologize for my tardiness. We have had several interesting conversations with some local school superintendents after some legislation yesterday, so that was the reason for my delay this morning. Committee, I appreciate your opportunity to speak before you today. I'm presenting Senate Bill 163. First, my name is Killian Timoney. I represent the 45th District, which is in Southwest Lexington. I'm carrying this bill for Senator Kerr. This is a bill that is a compassion bill. The Kentucky Charitable Health Care Services Act allows for agencies and programs caring for indigent populations to be reimbursed for medical professional liability insurance premiums. A companion law, KRS Statute 30440-75, defines which programs can be designated charitable health care providers and receive such reimbursement. Currently, statute excludes those agencies which provide invasive or surgical procedures. This bill was prompted by the group Surgery on Sunday. It's a local nonprofit established in Lexington in 2005.
Thank you. We have a motion and a second on the bill. Do we have any questions? Representative Frazier.
Thank you, Representative Timoney. It's good to see you here today. Glad to see you can join us.
Yes. Thank you.
On page 3, line 20, it says that a copy of the registration filed with the Cabinet for Health and Family Services under KRS 216941. I was wondering if you could explain that statute a little bit, please.
I'm supposed to have two guests with me here today. Amanda Ferguson, who is the chairperson of this committee, of the organization.
It's okay.
And she would be there. But I appreciate that question.
Thank you.
I see what you're doing there. Thank you. It's an excellent question. Just going to file that one away.
All right. Thank you. Representative Birch, did you have a question?
Yes, ma'am. How many people do you estimate this will serve?
Well, the purpose behind this bill is to assist the surgeons with some kind of fiscal leeway to increase the number of services moving forward. This bill did pass the Senate unanimously, 36-0, because the intent is the savings that the surgeons will accumulate will allow for additional procedures.
Okay, thank you.
You're welcome.
Okay. Seeing no further questions, Secretary, please take the roll.
Representative Bentley? Yes, Representative Bowling?
Yes.
Representative Bray?
Yes.
Representative Birch?
Yes.
Representative Dotson?
Yes.
Representative Elliott? Yes. Representative Fleming?
Yes.
Representative Frazier?
Yes.
Representative Marzian? Representative Prunty?
Yes.
Representative Rayburn?
Yes.
Representative Raymond?
Yes.
Representative Riley?
Quickly explain my vote. Representative Timoney, I appreciate those clear and concise answers, and I'm a yes. Thank you.
Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Yes. Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes. Senate Bill 163 passes with favorable expression. I appreciate your very efficient and clear testimony. Thank you very much for being here. And Representative Weber, do you want to register some votes?
Yes, Madam Chair. I would like to record yes votes on House Resolution 78 and Senate Joint Resolution 59.
Thank you so much. Okay. See no further business. I will adjourn this meeting and thank everyone for all their work during the session. We are adjourned.
Thank you, committee.